Today is the weekend. Mr. Hoàng Văn Kiên, who is the official in charge of medical waste disposal at Ba Bể District Hospital, is conducting the treatment for medical waste of the hospital and of other healthcare centers within the district. The old technology medical waste incinerator generates a lot of smoke, badly affecting the surrounding environment. This is the common treatment of medical waste in healthcare centers within the two provinces of Cao Bằng and Bắc Cạn.
Xử lý về lò đốt nó cũng có cái hạn chế là
The old incinerator has limitations such as generating a lot of smoke and badly affecting the surrounding environment. It also breaks sometimes and is unoperational.
Không đốt được. Một tuần tôi phải
I have to handle this problem 3 to 4 times per week, badly affecting my health.
Phải nói là rất ảnh hưởng đến sức khỏe.
However, due to high expense of incinerator and expensive operational costs, some healthcare centers are not well equipped with the medical waste incinerator. The medical waste have been directly burnt or buried in the tanks, which can potentially be hazardous. This is just one problem of the management and disposal of medical waste in Cao Bằng and Bắc Cạn provinces. Cao Bằng and Bắc Cạn are mountainous provinces with many difficulties in economics. 90% of the population are poor and of ethnic minorities. With hundreds of health facilities from the community level to provincial level, the medical waste generated per day in two provinces is significant. However, due to many reasons, the medical waste collection and disposals are still having limitations, especially with the hazardous waste. The current difficulties these provinces are facing include lack of management skills, awareness of participants, implementation methods, and financial resources. According to these circumstances and within the framework of the project VIE-027, the project has piloted the program of medical waste management in the provinces of Cao Bằng and Bắc Cạn. The goal of this program is to improve management capacity and support the hazardous medical waste disposal for health facilities in the two provinces. The objective of this program is to raise awareness, improve the management skills of staff, and apply the green model of medical waste management in a safe and efficient manner at the local health facilities. The program was piloted in 6 districts of the two provinces, which are Hà Quang, Trung Khánh, Nguyễn Bình districts of Cao Bằng province, and Ba Bể, Ngân Sơn, Nari districts of Bắc Cạn province. In cooperation with the Vietnam Health Environmental Management Agency, VMR, Ministry of Health, the project has developed the program's activities. Being the expert, VMR has coordinated with the project to develop the program activities which are in line with the current situation and local context. In order to achieve good results, the project conducted a survey to assess the current situation of the management and disposal of medical waste in two provinces. Then the contents were developed and inception workshops were organized with the consensus of the provincial authorities, leaders of health department, and other relevant agencies at provincial level on implementation approaches and methods of the program in the two provinces. At the workshop, professionals, doctors, and senior technical advisors of the project have introduced the importance of green technology in medical waste management. The green program on medical waste management of VIE-027 project, the networking model of district hospitals and commune healthcare stations on medical waste management, and communication posters on green definitions and environmental sanitation. The on-site training courses were conducted afterward in 6 district hospitals with the participation of management staffs and in-charge officers who were in charge of medical waste disposals in 109 communes. At the workshop, the participants were trained on the generating source of medical waste, the impact of medical waste on people's health, and on the local environment. The importance of medical waste management, establishment of medical waste management systems in local healthcare facilities, a standard procedure for classification, packing, transferring, disposing of solid medical waste, training method, and ensuring the safety in medical waste management. Through training workshops, the participants have improved their skills on medical waste management, as well as understood the importance of hazardous medical waste disposal. It would help to better dispose the medical waste and to create a greener, healthy environment. Through training to improve skills of medical waste management, which within the framework of the project, we have gained certain results. The first thing is knowledge on green technology for medical waste disposal. The second is the regulations of Ministry of Health regarding the collection and classification. The third is the coordinated model in medical waste disposal. And the fourth is safety rules in medical waste disposal. After the training, we have applied medical waste treatment at hospitals, especially since the project provided an autoclave sterilization to our hospital. The waste has been better thoroughly disposed. Another important activity of the program is to provide the equipment for hazardous waste disposal with green technology to local health facilities. The disposal of hazardous waste is the final stage of waste management, but it is a very important stage. The autoclave provision is expected to thoroughly solve the existing problem of disposal process of hazardous medical waste. The autoclave sterilization, which was provided by the project, are using green technology according to European standards. The hazardous waste, after steaming, will be heated under high pressure by a pre-installed program, which ensures the completed sterilization. The waste, after treated by the autoclave process, can be handled as normal waste. The new technology autoclave sterilization will provide it to 6 districts, including 6 large autoclaves for various district hospitals and 17 small autoclaves for the commune healthcare station. The autoclave provision at the commune and district follows the coordinated treatment model in medical waste disposal. The hazardous waste from the nearest commune healthcare station will be transferred to the district hospital for disposal. The remaining communes are divided into 3 clusters. Each cluster will have 1 small autoclave for the primary treatment of medical waste. With this model, medical waste will be treated more oftenly. The waste transferring process is shortened and more safely. The time for waste disposal is significantly reduced. The healthcare clinic in Nafak is a health facility under Ngân District Hospital and located within the premise of the healthcare station in Nafak commune. Previously, the medical waste is daily collected and directly burnt, then weekly buried. Since the commune healthcare station is equipped with a new autoclave, the hazardous medical waste is transferred directly to the station to be disposed every day. It helps to protect the local environment sanitation in accordance with the regulations of the Ministry of Health. Since the healthcare station of Nafa commune was equipped with an autoclave sterilization, we often transfer the medical waste from the station to be disposed of before buried. After a period of operating, the autoclave has performed its functions very well. It has been not only effective in technical procession, but also in saving costs, less operating costs, as well as solving the difficulties in the process of waste collecting and transferring. Back to General Hospitals of Ba Bể District, Mr. Kian was very excited since the project VIE 027 provided a new technology autoclave. He operates the autoclave for sterilization of medical waste from his hospital and other nearby health facilities every day. His work has now become quite less heavy. He shares.
Từ khi được dự án VIE 027 cung cấp cho cái máy
Since the project VIE 027 provided the new technology waste autoclave to our hospital, I found it very convenient. Its technique does not badly affect the surrounding environment and to myself.
Bị ảnh hưởng đến sức khỏe của bản thân.
The new technology of waste disposal have clearly shown the efficient impacts to residents who are living in surrounding areas of the local health facilities. Ms. Lâm Thị Tuyết and her family are living next to the Ngân Sơn District Hospital. The hospital previously used to burn medical waste on the weekend, sending smoke to the residential area. The local kids used to have respiratory diseases. Since the new techniques were applied, the environments in the surrounding areas have been getting better improved. The hospital previously used to burn the medical waste on the weekend. We felt very uncomfortable with the smoke, but since the new autoclave was applied, the environment in our area has been fresh and our kids are no longer coughing. After implementation, the project, in cooperation with the Center for Environmental Information, has teamed up with a monitoring group to visit all relevant stakeholders involved in the program. The purposes of this visit are supervision, monitoring and retraining on the treatment of medical waste from the step of the collection to classification, transferring and disposal. After nearly 1 year of program implementation, the effectiveness of the program has been visible through the improved awareness of the management officials and professional staff at the health facilities in the two provinces. The waste classification, recording and filing management has been seriously taken into account. The waste treatment process with new equipment is regularly done. The autoclave sterilization works well and safe. Staff who are in charge clearly understand and strictly follow the procedures. It aims to bring a sustainability to the program by protecting the environment better and saving their own health, as well as the local communities. Since the project implemented at Ngân Sơn district, the trainings has been intensively conducted from district to commune level. The commune officials have all been trained on medical waste storage, collection and disposal procedures in accordance with regulations of the Ministry of Health. All officers are updated with basic knowledge regarding waste management. At the same time, the project has equipped a new technology, autoclave sterilization for Ngân Sơn district, which help transfer the hazardous medical waste into normal waste. It can help to better manage the medical waste to the local in an effective way.